Welcome to this month's Well Aware presentation. In order to hear the narration, please be sure to turn on your speakers. The presentation will start momentarily and will automatically play. You can pause the presentation at any time by clicking on the lower left of your screen. The theme for this month's wellness presentation is Who Can Help Me with My Chronic Pain? A Holistic Approach to Relief. We will discuss the various resources available and give you tips on who you can bring onto your pain relief team, how you can think outside the box with alternative and non-traditional therapies and treatments, and what your next steps could be. We're going to take a look at what chronic pain is and what options are available for your treatment. So what is chronic pain? Pain that lasts for 3 months or longer is called chronic. Pain is your body's way of telling you that something is wrong. Chronic pain can occur anywhere in your body. It can range from being mild and annoying to being so bad that it gets in the way of your daily activities. Chronic pain is common in older adults, but note that it's not a normal part of aging. Sometimes the pain can be a result of long-term medical problems, such as diabetes or arthritis. However, the cause of chronic pain is not always clear. It may occur because brain chemicals that usually stop pain after you get better from an illness or an injury are just not working right. Damaged nerves can cause pain. But chronic pain can also occur without a known cause. But rest assured, there is hope. There are treatments that are available, so hopefully you won't have to live with chronic pain that gets in the way of what you want to do with your everyday life. So oftentimes when I'm talking with residents who are dealing with chronic pain, I hear things like, my doctor has tried to help, nothing's really working, my pain medicine doesn't help, I'm just going to have to live with this. But there are a lot of resources that are available that not everybody knows about. So what we're going to be talking about now are some of the resources that you can tap into to help you deal with your chronic pain. There's a medical discipline out there that not a lot of people are familiar with, but can be very helpful when it comes to pain control and relief, and that's called physiatry. Physiatrists, or rehabilitation physicians, are nerve, muscle, and bone experts who treat injuries or illnesses that affect how you move. A physiatrist's treatment focuses on helping the patient become as functional and pain-free as possible in order to participate in and enjoy life as fully as possible. Another potential member of your team can be a pain management specialist. A pain management specialist uses an in-depth knowledge of the physiology of pain, the ability to evaluate patients with complicated pain problems, the understanding of specialized tests for diagnosing painful conditions, appropriate prescribing of medications to varying pain problem, and skills to perform procedures such as nerve blocks, spinal injections, and other interventional techniques that we'll talk about later in this presentation. Many people are familiar with the word chiropractor and what a chiropractor can do to help, but you might not be aware of all the measures they can help you with in terms of pain control. Chiropractic care is used most often to treat neuromusculoskeletal complaints, including but not limited to back pain, neck pain, pain in the joints of the arms or legs, and headaches. Chiropractors practice a drug-free, hands-on approach to health care that includes patient examination, diagnosis, and treatment. They have broad diagnostic skills and are also trained to recommend therapeutic and rehabilitation exercises, as well as to provide nutritional, dietary, and lifestyle counseling. They are experts at looking at you from a full body point of view and thinking outside the box with holistic and alternative treatments. A very important but underutilized member of the pain control team can be your pharmacist. You can consult with your pharmacist to verify that there are no interactions with your prescription medications. They can take a look at all the medications that you're on, including your pain medications, to make sure that there aren't any contraindications between everything that you're taking. They can give you direction on how and when you should take your medications for the most effective relief. They can give you suggestions for over-the-counter medications or natural supplements that would not interfere with your current medication regime. Just because you can buy natural supplements and over-the-counter medications without a prescription doesn't mean that they're always going to be safe for you, especially depending on what other medications or health conditions that you might have. That's why it's very important to use your pharmacist as a resource so they can help guide you with some of that information and to make sure that what you're taking is as safe as it can possibly be and the most effective. Consider talking to your primary care physician about bringing on board a physical therapist to help you with your pain relief. Physical therapy involves a number of different types of pain management methods, including massage and manipulation of joints and bones, manual therapy using hands or tools on soft tissue, cold laser therapy to alleviate inflammation and pain and release endorphins. Endorphins are the body's, what I call the happy hormone that helps you feel better. They can also do microcurrent stimulation, which emits alpha waves into the brain and increases serotonin and dopamine to alleviate pain naturally. Serotonin and dopamine are also what I would call healthy hormones and happy hormones. Physical therapy can also work with you on movement therapy and an exercise program. To get started with a physical therapist, all that's necessary is an order from your physician. And you can get physical therapy services either from an outpatient agency or clinic, or if you qualify, they can come to your home under Medicare home care services. There's another member of the team that I wish more people would take advantage of their services, and that is the psychologist or psychiatrist or counselor, social worker. Psychologists are experts in helping people cope with the thoughts, feelings, and behaviors that accompany chronic pain. For patients dealing with chronic pain, treatment plans are designed for that particular patient. The plan often involves teaching relaxation techniques, changing old beliefs about pain, building new coping skills, and addressing any anxiety or depression that may accompany your pain. This would be an important thing to talk over with your primary care physician or your healthcare navigator in your own community. Palliative care is oftentimes an underutilized and sometimes misunderstood practice. A lot of people think that palliative care is the same thing as hospice and will say, well, I'm not ready for hospice. I'm not at the end stages of my life. I'm still wanting treatments. But palliative care is not the same as hospice. What they take a look at is if you have chronic diseases, and they work on symptom management and pain control. Palliative care deals with the treatment of problems including pain, nausea, loss of appetite, depression, and fatigue. All symptoms are addressed, including physical, emotional, and spiritual problems. Family is often considered to be part of the palliative process and brought in with the planning by your request, only by your approval. If you're interested in talking more about palliative care and if that's something that you'd be able to benefit from, don't hesitate to talk it over with your physician or your healthcare navigator. Now that you've heard about all the different potential members of your pain treatment team, we're going to move into talking more specifically about the actual treatments and procedures that you might be able to use. to help relieve your pain. First of all, we're going to look at it from the traditional medicine point of view. So the first thing that I'm going to talk about that is one of the most utilized methods of pain relief are pain medications. So we're all familiar with the wide range of medications that are out there, both prescription and over-the-counter. I won't spend a lot of time talking in depth about them, but I did want to touch on each one just from a broad overview. Non-steroidal anti-inflammatory agents are very commonly prescribed. These would include your Motrins, ibuprofens, Advils, Aleve. They work on pain control, and they also work on reducing inflammation. Another medication that's over the counter that's very common are the acetaminophen, otherwise known as Tylenol. Those work also with pain control, but they do not have that anti-inflammatory component to them. However, they are a lot gentler on the stomach and sometimes can be used in situations where Motrin or ibuprofen wouldn't be able to be used. Say, for example, if somebody has a history of chronic ulcers in the stomach, or if they're on blood thinner medication like warfarin. Sometimes antidepressants are used, Prozac, Zoloft, Lexapro, Cymbalta, again for the reasons that we talked over before. When you're dealing with chronic pain, oftentimes depression and anxiety can come along with that. Some physicians find that anti-epileptics work well for pain control. That's a medication that oftentimes is used for other reasons, but does work for pain relief in some patients. Opioids, controlled substances like OxyContin, Vicodin, Norco, fentanyl, those are typically used if all other medications have been tried first, or in instances of more severe pain. They do come with their side effects, so it's very important to take them only as your doctor orders, but they can be very effective with pain relief. And sometimes muscle relaxants can be used, depending on the particular kind of pain that you're having. Most likely, your physician will start you with medicines that cause the fewest side effects. From there, if that's effective, then great. Then you can stay on those for as long as your treatment plan allows. But if it's not effective, then they can start working with you to either increase the dosage, change it around a little bit, and to really find what works specifically for you. It's important to be safe with any medicines that you take. Make sure you read and follow all the instructions on the label and take them just as they're ordered. Medications can help control chronic pain, but be aware that sometimes it might take a little bit for it to start being effective. So be patient with it. Make sure you openly communicate with your physician. Let your physician know about your symptoms and how the medication seems to be working for you so they can help build the correct plan for you. Sometimes medicines can work best when it's used alongside other types of treatment. For example, physical therapy can be something that's very important to help really fix or work on whatever the underlying problem is that's causing your chronic pain. But if you're having pain, you can't do your physical therapy as diligently or as thoroughly as you might need to. So to take a pain medication before you have your physical therapy might be a good strategy, so you can really work hard at that physical therapy and in time find more long-term pain relief. Pain medications won't fix the underlying problem of the pain, so working in tandem with the physical therapy or other treatment options might be a very good plan. Sometimes a medicine loses some or all of its ability to work when it's used daily over a long period of time. This is because your body develops a tolerance to it. If this happens, you may need to take more of the medication, change medications, or add another medicine, but please make sure that this is done with your doctor's input. You want your physician to be directing your pain relief through your pain medications, because it can be very dangerous if you start to self-prescribe or to take more of something or to combine things. You want to make sure that your physician is working with you on those changes. Another pain relief treatment that you can talk over with your physician are cortisone injections. Cortisone shots are injections that are most commonly given into joints, such as your ankle, elbow, hip, knee, shoulder, spine, and wrist. Cortisone shots usually include a corticosteroid medication and a local anesthetic. In many cases, cortisone shots can be administered right at your doctor's office. However, the number of cortisone shots you can receive in 1 year generally is limited because of potential side effects from the medication. Another treatment that you can consider discussing with your physician are epidural injections. These are used primarily for back and neck pain. Relief from epidural injections can tend to be temporary. However, an injection can provide you sufficient pain relief to allow a patient to progress with a rehabilitative stretching and exercise program, thus working on helping to fix and remedy what the underlying problem is while giving you that pain relief while you're going through that therapy. If the initial injection is effective for you, you can have up to 3 epidural injections in a 1-year period. We can talk now a little bit about nerve blocks. Nerve blocks are used for pain treatment and management. Often a group of nerves called a plexus or ganglion that causes pain to a specific organ or body region can be blocked with the injection of medication into a specific area of the body. The injection of this nerve-numbing substance is called a nerve block. Another treatment that you and your pain team can consider is radiofrequency ablation. An electrical current produced by a radio wave is used to heat up a small area of nerve tissue, thereby decreasing pain signals from that specific area. A very common kind of pain control treatment is using a TENS electrode placement system. TENS stands for transcutaneous electrical nerve stimulation, and they're usually used for nerve-related pain conditions. TENS units work by sending stimulating pulses across the surface of your skin and along the nerve strands. The stimulating pulses help prevent pain signals from reaching the brain. TENS units also help stimulate your body to produce higher levels of its own natural painkillers called endorphins. And we've spoken about endorphins already. Those are your happy hormones. So TENS units oftentimes can be used by your physical therapist. They are starting to make them for your own home use, personal kits. I personally don't feel that there's enough information out yet to tell us if those are workable systems, if they're safe, but it's definitely something you could talk over with your physician. And if your physician recommends a home TENS electrode unit for you to do on your own, then that would be a great addition to your pain control treatment plan. Next, we're going to talk about trigger point injections. Trigger points are focal areas of muscle spasm, often located in the upper back and the shoulder areas. And as you can see on the picture, this is a listing of some of the main trigger points that people would have in their body. A trigger point injection involves the injection of medication directly into the trigger point. Trigger point injections can be used to treat a number of conditions, including fibromyalgia, tension headache, and myofascial pain syndrome. Oftentimes, your pain team will try the least invasive method of pain control, working its way up until they get to a point that nothing else is very effective. And then they can start discussing with you some alternative treatments that maybe are a little bit more invasive, but would be able to help relieve you of some of the pain that you're experiencing. One of those treatment options could be a pain pacemaker, otherwise known as a spinal stimulator. What this can do is it can manipulate nerve pathways, significantly reducing chronic back pain for patients who have exhausted all other therapies or options that include surgery. A second invasive type of treatment could be the installation of a spinal drug pump. The spinal infusion pump delivers concentrated amounts of medication into the spinal fluid, thus continuously bathing the pain receptors on the spinal cord with pain medication. This allows you to eliminate or substantially decrease the need for oral medications for pain. It delivers medication around the clock, thus eliminating or minimizing breakthrough pain and other symptoms. Breakthrough pain is the pain that you might experience in between your doses of oral medications. Sometimes pain might come too soon, and you can't take your pain medication because the time hasn't been long enough yet to take it safely, but you are experiencing that return of your pain. A spinal drug pump can help prevent those pain breakthroughs from happening. Well, we've spent some time now talking about more of a traditional medicine approach to pain control. But there are other alternatives that you can consider as well, and I'll just group them under the heading of holistic therapies. Keep in mind that insurance companies are starting to realize the benefits of these holistic therapies more and more, and are starting to cover more of them. My recommendation to you is before you start any of these holistic therapies, give your insurance a call and ask them if this is something that they will cover, how much of it would be covered, and if there are any specific practitioners that you need to use in order to have your benefits through your insurance. Acupuncture is a practice that is gaining more and more popularity. Acupuncture is a system of complementary medicine that involves pricking the skin or tissues with needles used to alleviate pain and to treat various physical, mental, and emotional conditions. And as you can see by the chart on the picture on the screen, it shows all the different places that an acupuncturist might give you treatment for the different conditions that are listed. A similar type of treatment without the actual use of needles is acupressure. Acupressure points are places on the skin that are especially sensitive to bioelectrical impulses in the body and conduct those impulses readily. Stimulating these points with pressure, needles, or heat triggers the release of endorphins, which are the neurochemicals that relieve pain. As a result, pain is blocked and the flow of blood and oxygen to the area is increased. This causes the muscles to relax and promotes healing. So whether your practitioner uses the needles with the traditional acupuncture or pressure stimulation with acupressure, they both are trying to achieve the same goals. Meditation can be a very important and helpful part of your pain relief regime. Studies suggest that meditating can increase pain tolerance, activity levels, and self-esteem, and can decrease anxiety, stress, depression, and the use of pain medications. Mindfulness meditation has been used successfully in programs to reduce pain and improve mood in patients with chronic pain from a variety of conditions, including headache, low back pain, chest pain, and gastrointestinal pain. At the end of this presentation, you'll be provided with a YouTube playlist, and in that playlist are several videos that can help talk you through a pain relief meditation. In addition, the resource guide that you'll be provided with has some information as well about meditation practices that you can do on your own. Biofeedback is a technique you can use to learn to control your body's functions, such as your heart rate. With biofeedback, you're connected to electrical sensors that help you receive information about your body. This feedback helps you focus on making subtle changes in your body, such as relaxing certain muscles to achieve the results that you want. And this can be very helpful when you're looking at pain control methods. Learning different relaxation techniques can be beneficial at pain relief. Relaxation exercises calm your mind, reduce stress hormones in your blood, relax your muscles, and elevate your sense of well-being. Using them regularly can lead to long-term changes in your body to counteract the harmful effects of stress. Trying different exercise group programs might be beneficial for you as well. Programs like yoga or Tai Chi. Regularly practicing yoga, a form of mind-body exercise that combines physical postures with relaxation and specific yoga breathing techniques, may help provide chronic pain relief. I hesitate to talk about this one just because the research behind it is still very unclear, and hypnosis as a practice, sometimes if performed by an unethical practitioner, can put you at risk. But I did want to talk about it because there are people who have benefited significantly from hypnosis for pain control. Research has shown that medical hypnosis can be helpful for acute and chronic pain. When hypnotized, a person may experience physiologic changes, such as a slowing of the pulse and respiration, and an increase in alpha brain waves. The person may also become more open to specific suggestions and goals, such as reducing pain. In the post-suggestion phase, the therapist reinforces continued use of the new behavior. My recommendation to you would be, if you're considering using hypnosis, to talk it over with your medical care team to make sure that you get a recommendation from a reliable practitioner, to make sure that you are going to be in the hands of somebody who will be dealing with you ethically and safely. Finally, we'll talk about massage therapy. Everybody loves this one, but the good thing is more and more insurance companies are realizing the therapeutic benefit of massage and are willing to pay for the services. People with chronic pain often turn to massage therapy to help naturally improve their quality of life. During massage, there is a release of serotonin, which is the body's natural production of anti-pain chemicals. Again, one of those happy hormones. Additionally, an aggravating factor in pain syndromes can be a lack of deep restorative sleep. Massage is very effective at increasing your deep sleep. With more deep sleep, you might have less pain. So I know we've talked about a lot of information. We talked about all the members of your pain care team that you can consider. We've talked about traditional treatments and procedures for pain control, as well as holistic types of alternative treatments that you can consider. But you might be saying, all right, this is a lot of information. What do I do with this? Where do I go? How can I find these practitioners and get some of these things rolling? So your next step that I would suggest to you is to make an appointment to talk to your physician. Take notes, take this PowerPoint along with you. Make sure that you have an open dialogue about your particular pain needs, your symptoms, your frequency, what's going on with you, so then your practitioner can work with you to bring on some of these team members and treatments into your pain support plan. Another resource you have in your LCS community is your healthcare navigator or your residential health team. You can certainly have conversations with that person about what your needs are, and they can help work with you and put you in touch with these community resources and advocate for you with your physician. The important thing to remember is you are not alone. There are people out there that can help you with your chronic pain, and there is hope. You might find that after listening to this presentation that you have questions or you want more information about a particular part of the presentation. If that's the case, I welcome you to reach out to me, and I'm happy to answer your questions, provide you with that information that you're looking for. You're welcome to contact me by email at gregbeth@windermerelcs.com or by calling me at 630-681-4037. You have a whole residential health resource team behind you, and we would like to work with you to help support you with any of this information that we brought to you today. Some people might want to do a little bit more research specifically about the particular kind of pain that you have. So here are some websites that you can consider visiting to get more information about chronic pain and what treatment options are available for you. Thank you for joining us today as we talked about chronic pain in our Well-Aware presentations. I hope you enjoyed it. I would enjoy hearing from you and hearing any comments, and I look forward to sharing another presentation next month with you. Best wishes and be well.